A time will come to ask questions about what we did right and what we did wrong. That has always been the Prime Minister's stock answer when confronted with the statistics that show the scale of the death toll from the coronavirus overall and in particular in our care homes. Yet yesterday, Boris Johnson departed from that script.
One of the things that the crisis has shown is that we need to think about how we organise our social care package better, if you remember, and how we make sure that we look after people better who are in social care. I think we discovered too many care homes didn't really follow the procedures in the way that they could have, but we're learning lessons.
Too many care homes didn't really follow the procedures. Those comments angered some who thought he was pointing the finger of blame at them. Let's talk to Mark Adams, Chief Executive of the charity Community Integrated Care, which supports people with learning disabilities and mental health problems. Morning to you.
Good morning, Nick.
What was your feeling when you heard those comments?
I probably can't say on national radio, but let's just say unbelievably disappointed. I think that this at best was clumsy and cowardly, but to be honest with you, if this is genuinely his view, I think we're almost entering a Kafkaesque alternative reality where the government set the rules, we follow them, they don't like the results, they then deny setting the rules and blame the people that were trying to do their best, and it is hugely frustrating.
Why do you say cowardly?
Because you've got 1.6 million social care workers who, when most of us are locked away in our bunkers waiting out COVID and, really trying to protect our family, we've got these brave people on minimum wage, often with no sickness cover at all, going into work to protect our parents, our grandparents, our children, putting their own health and potentially lives at risk, and then to get perhaps the most senior man in the country turning around and blaming them on what has been an absolute travesty of leadership from the government. I just think it's appalling.
A travesty of leadership, you say. Now, Number 10 sought to clarify what the Prime Minister was saying yesterday, saying nobody knew what the correct procedures were because the extent of asymptomatic transmission was not known. In other words, it was not known that people moving from care home to care home could be spreading the disease even though they weren't displaying any symptoms of it. Do you think that will be what finally is concluded as being the real problem in our care homes?
No, I don't at all, and I think there was a famous quote from the 1984 novel by George Orwell: who controls the past controls the future, and who controls the present controls the past. And I think what we're getting is history rewritten in front of us, when you could list pages and pages of government failure which the system has had to cope with, and to get a throwaway comment almost glibly blaming the social care system and not holding your hands up for starting too late, doing the wrong things, making mistake after mistake, it is just frankly unacceptable.
People will be able to hear your obvious rage about this. Let's just briefly, if you would, look at the situation now. Are your staff getting the tests you think they need and getting the results quickly enough in order for you to protect residents in your homes?
Okay, let's just go through a couple of quick facts. We've got a situation where the whole of the social care system has had to source 90% of its PPE since the beginning of the crisis, and that's still the same. You've got the testing, which the World Health Organization in February was saying is absolutely fundamental to handling a pandemic. Test, with the comments being made in the middle of February, and we abandoned that as a government policy. When we reintroduced it, because we suddenly realised that Neil Ferguson's projections were terrifying in terms of the number of people we would lose, we focused on the NHS and we focused on building capacity for the NHS. We didn't test social care until the end of May. So, us, like most social care operators, had our losses before we'd even started having any testing at all. Yes, the testing has now reached a point where most of our staff in care homes and most of the residents in care homes have been tested once. But once is absolutely useless, because if you get tested and then get on the bus back home and you pick up the virus on the bus, within a week you're potentially asymptomatic and infectious. We have been crying out for weekly, or ideally twice weekly testing for months, and we've only just got that commitment, and it's a question of the horse bolting and shutting the stable door.
Mark Adams, Chief Executive of the charity Community Integrated Care. Thanks for joining us.